Well, I'll say good morning, everyone. I see we've still got people joining us. We've got about 91 people online at the moment, in addition to our panel. And welcome to the Mental Health and Wellbeing in West Berkshire Forum, which we're putting on as Greenham as Greenham Trust, as one of our monthly or bi-monthly community forums. And we've worked together on this with our local MP, Laura Farris, to give what we believe is a very interesting and informative session this morning with a number of very high quality speakers talking about their own individual areas. If I can just run through how the morning is going to proceed over the next hour and a half. It's in three sections, basically. The first section is very much the overview with opening remarks from Laura Farris MP. Then we've got Matt Pearce and Dr. Michelle Sancho, both from West Berkshire Council, giving an overview of mental health in the district and then talking about the Emotional Health Academy and support in schools, respectively. Then the main bulk of the agenda is we've got a number of speakers. I'm not going to go through all of them, but basically we've got a great array of very high quality speakers talking about their own organisations from the charity and the voluntary sector, what issues they're facing and what activities they're undertaking in the context of mental health. And then we'll be wrapping up this morning with a Q&A session and closing remarks from Laura Farris MP as well, and we'll give you some of the list of resources as well. This will also be recorded this morning, so it will be available online. So if you've got colleagues who weren't able to join us, or indeed you'd like to watch it again, you'll be able to do that. Now, of course, mental health has been something of great importance throughout the pandemic that we've faced, well, over a year now, whether we've been working from home, whether we've faced our own personal challenges in form of bereavement or ill health and the like. Mental health has been a significant challenge and remains so as we come out of the pandemic. And that's why we thought it was very important working with Laura Farris to bring this to you this morning as well. And I think it's testament to the fact we have currently, 103 people online, of how important the audience sees this as well. So we have got a hashtag for this morning as well. So if you're on social media, if you can use the hashtag, please, it's hashtag Mental Health West Berkshire for that. So just if I can quickly talk about how you may ask questions, because I know a number of you will want to ask questions. We have got some questions we received during the course of the week, which will be dealt with at the end as well. So if you want to ask a question, everybody will remain muted. Click on the Q&A button, which is at the bottom, the center of your screen at the bottom on Zoom. You can type your question then into the box at the bottom of the pop-up window, then hit the send button, and then we'll see the question. We'll then be notified of that, and we'll answer it during the Q&A session. Obviously, we might get a significant number of questions. We'll do our best to answer as many as we can, if not all of them. And if there's any questions that can be answered during the course of the session, then my colleagues from the Greenham Trust team will endeavour to do that as well. So that's my introduction. Again, welcome everybody. If I can now hand over to our local MP, Laura Farris.
Thank you so much, Chris, and it is an absolute pleasure to be hosting this morning, and I couldn't be more thrilled actually with who we have speaking, not only from West Berkshire Council, but also some of our most valued and most sort of experienced mental health charities and groups in West Berkshire. And I was looking, at the list of speakers and the faces on the panes on my screen, and I realise I've worked with every single person who's speaking today in some form or other, but I don't think I've ever had the opportunity to bring them together. And the reason why I felt that it was important is because I know that I'm stating the obvious when I say that the last year has put unique pressures on everybody, but there were a few trends that I was beginning to see that I thought really deserved some urgent attention. And the first of them actually concerns young people, and it was on a trip to one of the secondary schools last autumn when a group of head teachers really stressed to me the level of anxiety that was being experienced by children really at every age in the school, although obviously all over 11 because they're at secondary school. And what they were really saying is that the experience of being out of school, and bear in mind this is before the lockdown that we've had this year, had just fostered really deep-seated sense of anxiety. In truth, not every child has either been able to access learning or has worked in the same way they would have done at school. And a lot of them felt really, really worried that they'd sort of missed too much, that they were never going to catch up, that their futures were in jeopardy, they didn't know what the future held. And they said that they were really concerned by what they were seeing. In addition to that, we know that young people have spent extended times on social media. I think it was inevitable given the way that they were living. And we know the very damaging effect that has on young people's self-esteem because of the unrealistic sort of lifestyles and images that they're bombarded with. Now, you may think, well, this is an ongoing problem, and you're right, but I still think it's something that has intensified over the last year. And so it seems to me, and from talking to, I think, all the heads of the secondary schools, there is a direct need actually to get support, more support into schools if we can, particularly over the next 12 months, as I hope we sort of return to normality, but we help young people to sort of overcome some of the issues that are causing them really particular problems and maybe holding them back in other ways. And actually, I want to move it also to talking about everyday residents of West Berkshire, because the truth of the matter is that in the last 12 months, unemployment in this part of the world has tripled, and that's actually less than what it's done in other parts of the country. We're still quite low relatively, but it's obviously a huge spike. People are moving out of having, you know, income coming in to moving on to universal credit, to, for the first time in their lives, having debt issues. And I was talking to the Citizens Advice Bureau, who again talked me through some of the mental health consequences they were seeing there. Now, obviously, the main part of my work is to do everything I can to support people back into work. But I think in the meantime, there is an immediate need to make sure they have the mental health support that they might need to meet really significant challenges. So I wanted to bring these resources together. As I say, I couldn't be sort of prouder of the people who've come and spoken to us, because all of them, they all do something slightly different, but together they form the fabric of mental health support in this part of the world. And I also want to pay particular tribute to the Greenham Trust, because they're the sort of spine of West Berkshire in the not-for-profit voluntary sector, and they're always such an incredible kind of ally in anything that you want to do to bring the community together. And Chris, I am truly grateful, and it's a delight to work with you as usual. So thank you very much for everything that you do.
Thank you, Laura, and thanks very much for joining us this morning. So I'd now like to move quickly on to Matt Pearce, who's going to give us an overview of mental health in the district. Matt, of course, will be known to many of you. He's a Service Director, Communities and Wellbeing, and a consultant in public health at West Berkshire Council. So Matt, over to you.
Thanks, Chris. Excuse me. And good morning, everybody. Appreciate you giving me the opportunity to speak at this great event, which I feel is such an important area of work going forward, and I know one that the council are particularly interested in supporting our residents going forward. So really what I wanted to do, just to open up really, is just to provide a little bit of context about mental health, about what we mean by mental health, what some of the data is telling us, but also the potential impact of COVID-19 on our mental health. So I thought it'd just be quite useful just to think about what we think mental health is, or what it's seen to be. And the definition at the top talks about mental health as a state of well-being. It's where individuals realise their own potential, they can cope with the normal stresses of life, they work productively, but they're able to make a contribution to their community. People often talk to other definitions such as intellectual, emotional, or spiritual development, positive self-perception, feelings of self-worth, or physical health. But the key thing is we all have mental health needs that need looking after, whether it is good, bad, or in the middle. But put simply, mental health is how you feel on a particular day. And we have days when we feel good and days when we don't. However, a person with mental health problem may have more days than good. And mental health problems can range from common mental health problems such as depression, anxiety, to more rare problems such as schizophrenia or bipolar disorder. However, one thing we do need to move on, which is this diagram at the bottom, is about thinking that mental health is something some people have, and that we only need to think about it when something is wrong. But actually what we know is mental health activity is on an ever fluctuating continuum, moving between mental illness and mental well-being. And we know that mental health can be due to a number of reasons. That could be such as unemployment, financial insecurity, loneliness, isolation, loss of education, working conditions, and so on. Next slide, please. So this is just really some national data, just to really highlight the importance of mental health and actually how common it is. So we know on the left-hand side, in terms of the population perspective, 1 in 6 children between the age of 5 to 16 has a diagnosable mental health condition. We know that depression and anxiety can be quite common during pregnancy or in the first year of childbirth. And we know that one of the most frequently referred to statistic is that 1 in 4 adults experience at least one diagnosable mental health problem in any given year. And then in terms of mental health care, it's estimated that up to 3/4 of people with mental health problems receive no support at all. And 75% of young people with mental health problems aren't getting the help they need. However, I need to emphasise, obviously, there's some really significant work going on both nationally and locally to improve that data. The other startling fact that we often refer to is those with severe mental illness, often at risk of dying 15 to 20 years earlier than other people. So a real cohort of people in terms of how we can support them. Next slide, please. So this is just a very high level data that comes from the Children and Young People Mental Health Survey that involved around 10,000 people nationally. And what they did, they grouped specific mental health disorders into 4 broad categories: emotional, behavioural, hyperactivity, and other less common disorders. Emotional disorders refer to things such as anxiety disorders, depressive disorders. Behaviourals, looking at a group of disorders such as repetitive or persistent patterns of disruptive and violent behaviour, and hyperactivity is inattention, impulsivity, and hyperactivity, and the others refer to autism disorders and eating disorders and so forth. And obviously, if you just look at the top row at the top, you've got mental health disorders, or so those to 5 to 10-year-olds, approximately 9.5% of those children have a mental health disorder. And this is for Berkshire West, I must emphasise, so this includes Reading and Woking rather than just solely for West Berkshire. And then if you look to 11 to 16-year-olds, approximately 14.3% have a mental health disorder. 17 to 19, it goes up to 17%. So it gives you a sense that actually it is quite common and something we need to think about going forward. What we do see is the rates of mental disorders tend to increase with age, and emotional disorders were the most prevalent type of disorder experienced by 5 to 19-year-olds. And since 1999, national data suggests a slight increase in the prevalence of mental disorders in 5 to 15-year-olds, with the majority of this increase coming in children with emotional disorders. And some of the key risk factors in terms of predictors for mental health are things such as demographic factors, sexual orientation, ethnic group, physical disability and health, social and family related factors such as family functioning, parental mental health, adverse life experiences, and then there's social economic factors as well, such as income, receipt of benefits, or neighbourhood deprivation. Next slide, please. So in terms of adults, some of this data is a little bit old, but it's estimated that about 13.2% of adults had a common mental disorder. So that could be any type of anxiety or depression. 12.3% of adults aged 18 or over registered with a GP in West Berkshire recorded as having depression. And the rate of hospital admissions for intentional self-harm was around 177.7 per 100,000, which is similar to the English average. And then with serious mental illness, and just outlining my point earlier, we know that they have a higher risk of early death, unfortunately, compared to those that don't. Next slide, please. So this infographic was designed by my colleague Rachel Johnson in the council quite early on in the pandemic, and this came from some work in Hertfordshire, and this just really tried to capture and think about what will be the potential impacts of COVID-19 on our mental health across the life course. I'm not going to go through this in any great detail, but it's certainly something we're going to think about going forward as we move through to recovery. And I guess that the point is that fear, worry and stress are normal responses to perceived or real threats, and at times when we are faced with uncertainty or the unknown. So it's normal and understandable that people are experiencing fear in the context of COVID-19. So it has been recognised that COVID-19 is potentially a public health emergency that exacerbates mental health inequalities with different impacts on a wide range of vulnerable groups. And added to the fear of contracting the virus in a pandemic are significant changes to our daily lives. Our movements have been restricted. We've had to slow down the spread of the virus. We've been faced with new realities. We've had to work from home, temporary unemployment, homeschooling of children, lack of physical contact with family members, friends and colleagues. And all of these have had an impact on our mental health and physical health. So what is some of the evidence coming through already in terms of what that impact has been? So it's loss of routine, uncertainty, grief, stress, worrying. However, for some, it has impacted positivity on their mental health. So it might reduce choice, more focus on what really matters to them, and slowing down. Some of the evidence on children is it's estimated around 20% of children and young people between the ages of 5 to 16 have developed a mental health need, although the rate is higher in girls and lower in boys, and higher in over 16s in lower in primary school children. But all this evidence is starting to emerge as we start to see the impact of the pandemic, and we're looking to collect that data as we go forward. In terms of what being the impact on adults, self-reported mental health and well-being, such as anxiety, stress and depression has worsened during the pandemic and remains worse than pre-pandemic levels. Next slide, please. So what we can do, it's not straightforward. It's quite a local government term we use as a whole system approach. Really, that is about people coming together, everyone understanding how we can work collectively to support people with their mental health and well-being, recognising that everyone has a role to play. We need to look at how the impact of the pandemic has disproportionately affected different groups of people on their mental health. And we need to promote good mental health in terms of prevention. It's not just about those with ill mental health, but it's doing things to ensure that people keep and have good emotional well-being. And then it's also about stigma. It's about reducing stigma, that parity of esteem, treating mental health and physical health in the same way. And I just want to make the point, there's actually lots of great work going on throughout West Berkshire, at the Berkshire West level by the council, the voluntary community sector groups, which we're going to hear about later on today to help support that. Next slide, please. So my final slide really, and again, we're going to hear a lot more about this over the course of the morning, but there's lots of resources and support out there. This is just a very high level list of them. And one of the best places to get a list of all those, access to those support agencies is through the West Berkshire directory, which the website is found on this final slide. So thank you very much.
Matt, thank you for an excellent overview there of what's going on in terms of mental health in the district. Well, it's quite clear we already had some significant mental health problems before the pandemic came along, and obviously that's exacerbated the problem. It's interesting, of course, you talk about young people particularly as well, although of course it goes across the whole age spectrum. You also talked about working collectively, and I think that's what this morning is all about, isn't it? It's bringing the various groups together, stimulating debate and hearing what other people are doing. So thank you very much for that. If we may move on now to Dr. Michelle Sancho. Dr. Michelle is basically going to talk to us about the Emotional Health Academy and mental health support in schools. She's the Principal Educational Psychologist and Service Manager at West Berkshire Council. Michelle.
Thank you. It's a pleasure to speak and join you today. Thank you, Laura, and thank you, Matt, for setting the context so well and prioritising mental health for children and young people. This first slide just shows the partners, really, that are working together to try and help and support with children's mental health. So whatever we do, we are doing that in collaboration with the council, but also with NHS, and we've got the mental health support teams, Emotional Health Academy and Emotional Health Triage, all working in partnership together. So today what I'm going to talk about is just talk a little bit about the model that we use locally, tell you a little bit about something called the Emotional Health Triage, tell you a little bit about the Emotional Health Academy, explain how the mental health support team works, and then a little bit about mental health education that children and young people receive in schools. So over to the Emotional Health Triage. Just before that, this is the model that we use locally. And that's just helpful for us to think about what type of support is best when. So the support goes from getting advice in the green, so maybe you don't have any particular difficulties, but it's always good to know how to stay well. So that we are supporting, including the Educational Psychology Service, schools and various other places to help people know how to stay well, particularly with the pandemic and the context that we're living in at the moment. We also, though, need to provide for people who need to get a bit of help. And that's where early intervention comes into play. Those who need sort of focus goal-based support, we want to try and support people to thrive despite the pandemic and various different pressures they might be in. And so some of the service I'll be talking about further really are within the getting help, and then the move towards the purple, which is the getting more help. So the services I'm talking about today kind of really fall within those. However, there is the getting risk support, and there are other aspects of getting more help, which is around sort of extensive specialist support. And so we work in partnership to make this wheel work, so that we all hopefully help it to be seamless, that you could go from green to blue to purple to orange. Of course, you might be in green and need to go straight to orange, depending on what's going on for you in your life. So that's sort of the backdrop of what we call the Thrive model, developed by the Anna Freud Centre. So the emotional health triage is really a hub where referrals come in, and that referrals can come in from anywhere. So parents can refer, children and young people over 11 can refer themselves. It can come from the GP, and there's been lots and lots of training over the last few years to help people know how to refer, but there's a website that makes it quite clear. So the triage is a place where the referrals come in, and then it actually helps. I suppose it's a hub to help think, right, actually, what might be the next step for a child or a young person. So it doesn't mean that they necessarily get that Emotional Health Academy. It's part of the Emotional Health Academy, but it's separate as well, because it's a place where we can sort of look at what's best. So it meets weekly. It's a multi-agency group, and a referral might be made from there on to CAMS, the Children and Adolescent Mental Health Service, because we think this person needs to get more help. It might be, actually, we think a bit of support in school might be the next step, and we might sort of help and support the school to help the child and young person. So we might feel that this is a sort of getting help. And there might be sort of the edge, where we've got information about sort of drug and alcohol. So the information comes into the emotional health triage, and then that triage looks at all the information that we have and then makes a referral suggestion to the next step. The Emotional Health Academy, on the other hand, is a service where you have primary mental health workers as well as emotional health workers. Emotional health workers can be brought in from schools. So quite a few schools decide that they would like a bit of additional support. If we could have next slide, please. And they decide that they would like to buy in some additional support. On this slide, you can see the range of people that the emotional health triage might refer onto. So onto the next slide. So the Emotional Health Academy, we have emotional health workers, which are a traded offer in schools, and schools buy in packages to provide early intervention support. They also deliver a range of group classroom interventions. They work sort of with families, provide consultation and training in schools, and really sort of trying to enhance what goes on within a school setting. Next slide, please. In terms of the primary mental health workers, that's a step up. Primary mental health workers provide assessment and intervention, and that's not necessarily within a school setting. They are allocated based on triage. So one of the outcomes of triage might be a primary mental health worker to work as a clinical worker directly with a child or a young person. And they're funded, and they're not traded, so that if you've got that level of need, then you could have access to a primary mental health worker. So it might be from the triage, you're identified of maybe having anxiety or low mood, depression, and you might be allocated a primary mental health worker. So Emotional Health Academy has a traded bit where schools buy in extra resources that they want from emotional health workers, but a non-traded bit. If you need the support of a primary mental health worker and it comes through triage, then you would be signposted to one of those. So moving on, we've got the mental health support team as well. So we're really fortunate here in West Berkshire that we have, we've been a trailblazer. So we got government funding to set up a mental health support team. And we were one of the first in the country to do that. So there's lots of learning taking place from what's been happening in West Berkshire. So it's a large scale pilot programme. And the government aim to have support available for between 20 and 25% of children and young people in England by 2022. I think that's been achieved. And there's close liaison with that mental health support team with the senior mental health leads in all of the schools. So the mental health support team at the moment serves about a third of the local authority. And we're hoping to get more mental health support teams, but they work in close collaboration with the Emotional Health Academy too, and they provide interventions. Next slide, please. So these are the different people that work within the mental health support team. You've got a sort of multi-agency group. So within 1/3 of the authority, you've got the mental health support team working, and with the other 2/3, you've got the Emotional Health Academy working with sort of primary mental health workers and the emotional health workers as well. Next slide, please. So this is a range of things that the mental health support team offers, a wide range: staff wellbeing support, student assemblies, support across the age range. So they support about 27 schools in West Berkshire, mental health surgeries, discussing any concerns a school has, one-to-one support for children and young people, resilience group support. There's a wide range of sort of training for staff and parents. There's been quite a lot of parent training that's been going on during lockdown that parents could sort of sign up to and access remotely. Next slide, please. There is also mental health education that schools provide themselves about mental health. There's the statutory health education that all schools deliver, and that covers mental well-being. It's delivered in both primary and secondary schools, and obviously, you know, there's a lot of children who have good mental health and well-being, but actually we want to teach them about how to stay well and how to maintain that well-being, but also how to understand when someone might be experiencing poor mental health and the factors that might contribute to that, and how to access help and support both for themselves and for others. So we've got a range within West Berkshire. We're really fortunate. We've got a range of help and support for children and young people, both in terms of the mental health education, which is in that green bit that we saw in the Thrive model, plus the Emotional Health Academy and the mental health support teams. So we also have a range of other things that support, for example, COOF that was on, which is a sort of online counselling support that you can access outside of any schools. So I hope that's been helpful.
Michelle, that has. It's been incredibly helpful. I've learned an awful lot there as well. I'm sure the whole audience has, really, in terms of the Mental Health Academy and the emotional health triage as well, but also the support you're giving to schools in terms of mental health education. So that was wonderful. Thank you very much. So that brings to a close the overview section of this morning. Now we're going to go into the next part, which is really what all the local organisations, the charitable and the voluntary sector are doing in terms of the context of mental health, both in terms of their own experiences and their own activities. So if I may hand over, please, to Andrew Sharp, who's the Chief Officer of Health Watch West Berkshire. Andrew.
Morning, Chris. Morning,
Good
everybody. First thing I wanted to do is just issue a huge thank you to both Chris and Laura for getting this set up with their teams. A huge thank you to the amazing panelists. I feel very honoured to be amongst such an esteemed company, and most importantly, 110 people taking part, which is really, really vital. Mental health remains a real Cinderella service in the UK, and it needs to be discussed more openly by us all, and most importantly, without stigma. You know, no one would think twice about discussing a physical illness or something in the street or something, but you know, if you were ever to say, you know, you weren't as well balanced today as you might be, you know, you do often get some odd looks. So we have to keep working on the stigma. And remember, it's okay to not be okay. You know, not every day is going to be fabulous. You know, I will happily tell you I'm having a bit of a wobbly morning because I've missed out on my Jonathan Van Tam ability to ask for the next slide because I haven't got any. So this has been a little bit less prepared than I probably would have hoped. So apologies for that. Hopefully you won't notice. Healthwatch West Berkshire is the statutory voice and champion for residents of West Berkshire when it comes to all matters of health and social care. And very importantly, this includes mental health, which has been key to some of our work over the last 5 years. We sit on really important boards like the West Berkshire Health and Wellbeing Board. And what we do is we take the residents' feedback and views to the commissioners, the service providers, the people who deliver things on the ground, and let them know what the problems are, what the good practice are, what the issues are, with a view that together we can all improve things. So all I want everyone to take from today with us is get in touch with us if you have some feedback, whether it's positive, negative, whether it's a little niggle, or really importantly, a compliment. You know, the services are stretched, and it's good to know when things went well as when things went bad. Or you can come and join us at one of our Thinking Together public forums on mental health. We've been running them since 2016. We've just run our 5th one virtually. There's a Thinking Together report coming out soon. We've also got a CAMS report, which I think will be of interest to lots of people, being published once we get through the election period. And we're planning our 6th Thinking Together event at the moment. So, you know, get involved with us, come and talk to us, and help shape the actual things we actually talk about there. We all need to work together to improve things. It cannot just be a service, the government, the council. It has to be the community. This has to matter to all the community. Remember, your voice counts, so do let us know. And I just really want to finish by just saying, you know, this has been such a tough year. So, you know, look after yourself, look after your friends, look after your family. Be kind is a good way to sort of move on. And I'll finish, and hopefully I don't get the bell.
Andrew, thank you. You're a long way from getting the bell, I assure you. Thank you very much for a very succinct presentation there. And I think you're right about removing the stigma of mental health and this fact that it is okay not to be okay. But I think one of your key messages there was for people to get involved through what Healthwatch provides. And I think that's very, very important. I think that's what this morning is all about. You alluded to the fact we have 110 people online, so people are getting involved. And I think this is the first, hopefully, of many opportunities for people to do that as well. So I think that's the key message, really, is get involved, and Healthwatch will enable you to do that. Thank you, Andrew. If we can move on now to Tammy Wilshire, who's the Charity Services Manager for Time to Talk, of course, who focus their support in terms of young people in our community. Tammy, if I could ask you to give us your presentation, please.
Good morning, Chris. Thank you very much. Yeah, I have the great honour of being the Charity Service Manager for Time to Talk West Berkshire. And for those of you who don't know, the core of what we do is we offer free counselling to young people aged 11 to 25. And we do that predominantly from our offices in Newbury. Young people can be referred to us from a number of different avenues, which we'll talk about in a few minutes. And they can be seen by a qualified counsellor, normally for up to 12 sessions. And actually, that is the core, but not all we do. And what I'd like to do is highlight some of the other things that we have been doing, or the ways we've been extending our counselling. We've already heard today why it's important, particularly for young people, but why it's important that we all take care of our mental health. What we know is that 75% of diagnosable mental health conditions emerge by the time somebody's 24. So if we can intervene, get in early and help young people, then that not only alleviates their suffering now, but that can have long-term effects for a much more positive future. How do we make sure that we see as many young people as we possibly can? Well, we do that in a number of ways. We have got a number of outreach stations, if you like. We have a counsellor in Hungerford GP surgery, in Wootton Hill, and also in Lambourne. Those are positioned because we know that those places are particularly rural, and those young people might not find it as easy to get to our Newbury hub. We also are in place in 6 secondary schools in West Berkshire, including Mary Hare and Brookfields. We span all the way over from Willink to John o' Gaunt. So again, we're trying to cover as much of the area as we possibly can. This year, we've started working also with a primary school, with Calcott Primary School, with another charity, Achievement for All, who are specifically focused on children and helping them to learn regardless of background or challenge. So that's been a really exciting project for us to be involved in this year, working with those 11-year-olds who, as we know, have had a particularly difficult year, and helping them perhaps with the transition over to senior school. Within our Newbury and our Thatcham hubs, that's the majority of our work. And another kind of positive thing for us to come out of lockdown is that now young people have a choice of how to receive counselling. If they want to come face-to-face into one of our hubs, they can, but they can also receive counselling by phone and online, which means that regardless of where you are, what your issue is, we're removing barriers to people receiving counselling all the time and allowing people to receive their counselling in a way that is comfortable for them. As you can see from this slide, our referrals come from a variety of different places. Another positive for us to come out of lockdown is, you can see on the right-hand side there, a little clip of our website, and it is now possible to refer yourself or a loved one by using our online referral form. We can actually see when those referrals come through to us, and a large number of referrals come in out of office hours. So you no longer have to make that phone call, whether it's 10 o'clock at night, 6 o'clock in the morning, that referral form is there, and that puts you straight onto our waiting list. Most of our referrals still coming from parents or from young people referring themselves, but we work with a number of other agencies, GP surgeries. We're part of the emotional health triage, which you've already heard about, and also other schools can refer to us. We have a very active young ambassador group who are really, really focused on raising awareness and reducing stigma for mental health. They are brilliant on social media, and that's really helping to get those conversations that we've already talked about going. I can only echo what Matthew said earlier in terms of figures. Every measure that we have tells us that mental health referrals and the strength of the issues are increasing. Our referrals are up on this time last year. We have more cause for concern about the young people that are coming to us, more safeguarding issues that we are genuinely very, very worried about young people. And also the general measure which we use to assess low mood, anxiety, depression, that average score has also gone up in the last 6 months. So more than ever, the events like this are fantastic to raise awareness. So thank you so much for having us. I look forward to any questions that we have a bit later on.
Tammy, thank you very much for setting the context there of why it's so important for you to focus on young people. I hadn't known actually that 75% of mental health conditions are diagnosed before people are 24. So that's, that's obviously very important, isn't it, in the context of you supporting young people. I think it's very good also to hear that, how people can refer themselves, self-referral to Time to Talk as well as being referred by other. And I think fantastic that you're offering it either face-to-face, by phone or online, given the context of the period we're sort of operating in. So thank you once again for that. If I can move on now to Sarah Ashworth, and Sarah is the Schools and Families Programme Director for the Charlie Waller Trust.
Sorry, Chris, it's Sarah Emery.
I'm going to step in because it says my name on the screen,
I'm
Chris.
sorry, I've got
I
the
don't
wrong
want to step
agenda
on
printed.
Sarah's toes.
I'm sorry, Sarah. I've obviously
That's
got the wrong
quite all
agenda
right,
here.
Chris. That's quite all right. There's lots of Sarahs around. Thank you. I'm just echoing what everyone else said. Thank you for having us this morning. I think, like everybody else, we have really seen the impact of COVID for young people, and we did a survey earlier this year with 800 young people, and 76% of those young people said mental health and wellbeing was one of their primary concerns at the moment. And 56% of those young people said that their mental health had significantly declined over this period of COVID. And we know there are a number of protective factors and promotion factors that can support young people's wellbeing. And we believe strongly in young people being equipped with the skills and knowledge to help manage their own wellbeing confidently and consistently, and especially, you know, as we move out of this period. So we've developed a wellbeing programme in line with leading education technology company Aspire to Be, thanks to some funding from Greenham Trust and also Berkshire Community Foundation. This programme is available to each of the secondary schools in West Berkshire, and those schools receive staff briefings for their staff to understand the programme and help make sure they're making the right choices around the students who will engage. We work with up to 50 students in those schools, and as you can see on the diagram, we do a little bit of habit tracking and a bit around Berkshire Youth App, and I'll explain each of those. So the workshops we deliver with young people are kind of interactive workshops. We're currently delivering those virtually, and this is to enable the most students to access the programme. Schools are selecting those pupils they feel most appropriate, so delivering it virtually currently allows us to kind of mitigate around class year bubbles and COVID restrictions, but I'm hoping we can certainly get back to delivering these face to face. The topics we focus on are around positive mental health and what the presentation of poor mental health looks like for young people. And we want young people to realise how they are in control of optimising their own mental health. We look at the science behind sleep and how body systems work and have an impact on their mental health, as well as promoting things like quality sleep and active lifestyle and healthy nutrition, and how they all have a role to play. The active wellbeing indicator and the habit tracker is a bespoke resource that we've built for the programme, and this is around the promotion of regular activities for young people. And these are activities that have been linked to wellbeing for wellness within young people. It's a 40-question questionnaire, and it looks at areas like energy, drive, thinking, strong relationships, and these have been based on research that's out there around things that can support young people's wellbeing. It promotes activities such as sleep, nutrition, and at the end of the questionnaire, young people are directed to resources that show them why these activities are important and how they're linked to their well-being, but also activities they can be doing to support people. So how things like volunteering can help promote people's mental health, being physically active, the foods they eat, and provides them with links and resources that will support those. The Berkshire Youth App is a progressive web app which further supports this. So this allows young people a point of contact for their continued learning, as well as further engagement with Berkshire Youth. Young people will find out about opportunities available to them locally, as well as links into existing projects and programmes. It also links to our Berkshire Youth Hubs, which were established at the start of the pandemic thanks to funding from Greenham Trust. We know how important it is for young people to have a sense of belonging and engagement with their peers and trusted adults, and how all of these things can have a positive impact on their well-being. And the app helps coordinate all of those for us and link them into such opportunities, which is especially important for some of those young people across our rural communities who may not be able to access those physical spaces. And young people will continue to be able to evolve and access these things as they move along their journey. I think the next slide, Marina, is just our contact details for anyone who wants to further discuss any of our projects and programmes, whether that's the Youth Hub, the link's there, We're on many a different social media platform, but please do, reach out, and we're more than happy to talk about how we can continue to support young people moving forward. Thank you, Chris.
Sarah, thank you for running through what Berkshire Youth are doing, again, on the theme of young people. Particularly excited by your app as well. I know that's been a very useful tool for you with young people connecting in a way they might expect to through social media. So now I would like to hand us over to Sarah Ashworth, who is Schools and Families Programme Director of the Charlie Waller Trust. Sarah.
Thank you, Chris, and good morning, everyone. Just a little bit about the Trust. It was set up in 1997 in response to Charlie ending his own life by suicide in September of that year at the age of just 28. He'd been suffering from depression and felt that he no longer had the strength to carry on. And this was at a time really when depression and mental health difficulties were not quite as talked about as they are today and were significantly less well understood. Back then, the Charlie Waller Trust's mission was to open up and encourage conversations around depression to ensure that young people were better able to understand and look after their own mental health, and crucially to spot the signs in others, and really importantly, to know how and where to access help. Charlie's families and friends were determined that his death would not be in vain. So moving forward to 2021, our vision is of a world where people understand and talk openly about mental health, where young people and those who support them are equipped to maintain and enhance their mental health and well-being, and have the confidence to seek help when they need it. And we realise this vision by providing mental health training and consultancy in schools, colleges and universities and the workplace. And our training is positive, so we take a positive and proactive approach to mental health, focusing on prevention and early intervention, and recognise the importance of offering hope. Our consultancy, training and resources are all based on sound clinical evidence too, and we give people practical strategies and tools to care for their mental health and to support others in doing so. We have highly skilled, experienced and qualified trainers delivering training and consultancy online and of course face-to-face, subject to COVID restrictions, and they work across England, Scotland and Wales. And between 2018 and 2020, we delivered 2,765 training sessions in schools and colleges. Of those, 2,088 training sessions and workshops for school staff, and to a total of nearly 190,000 people, including, of course, teaching staff, parents and students. Next slide, please. Really glad that I could say that. So focusing specifically on our work in West Berkshire, we've been working with Berkshire Healthcare Foundation Trust and the Emotional Health Academy to train mental health support teams with the psychological perspectives in education and primary care training, also known as PEP care. So this is a sustainable model which involves us providing training to equip other trainers to deliver evidence-based mental health training for all frontline professionals in the statutory and voluntary sector working in health, education and social care. And just in the last 3 months, our trainer, Lisa Thompson, has delivered 40 PEP care sessions to 1,094 local authority and school staff. We also deliver specialist modules to staff and parents and carers in the community, and are developing our work in this area to include workshops on understanding the adolescent brain and how that can manifest in particular behaviours. And this session is primarily for parents, and we also have further plans to roll out this training to teaching staff to help them understand and respond to children and young people at this particular age of their development. One of our key strategic priorities is working towards implementing the whole school approach to mental health and wellbeing in partnership with schools and local provision. We're able to work with individual schools over a period of time to provide training and consultancy in the whole school approach, which has already been mentioned, with the 8 areas of the approach shown in the graphic on the right. We understand that implementing this approach really helps to provide the best possible environment in which young people learn and build resilience, in addition to supporting the early identification of emerging mental health difficulties and targeted support for vulnerable children and young people. We work collaboratively with young people in the development of all of our services, which are provided free of cost, although we do ask schools to fundraise or donate to the Charlie Waller Trust, but only if they're in a position to do so. We're committed to providing inclusive training and consultancy to diverse populations, and this of course includes children and young people with special educational needs and disabilities. We're really conscious of the many challenges facing schools, families, young people and statutory and voluntary services during the pandemic and going forward into the post-pandemic period. And in particular, the disproportionate impact on disadvantaged children and young people and their families. And finally, we'd very much welcome the opportunity to collaborate further with partners locally to really develop our work with schools and families in West Berkshire. So thank you very much, Chris, for giving us the opportunity to talk to you today.
Not at all. Thank you, Sarah. And I'm sure there'll be many people wanting to talk to you about potential collaboration after the excellent presentation this morning. I was particularly interested to hear about your pet care training, actually. Thank you again for that. Thank you also to my colleagues and various panel members for responding to the questions as we're going along. I see we're doing a good job of clearing the questions and answering them as we're going along, and also all the panelists who've talked so far at keeping to time. If I may move over now to Grace Green, who's the Director of Home Start West Berkshire. Grace, good morning.
Thank you again for having us. We're very excited to be here. I wanted to talk to you about what Home Start do. So Home Start, our sort of core work is that we train volunteers to support families within the home. But one of the things that we've recognised over the years is how mental health plays such an important part in being a parent, and how it can have such a massive impact on the family as a whole when one person is experiencing depression. So we started up mental health services around 2010. And so we've got lots of experience now of working with families where one person's experiencing mental health difficulties. And we have a specific project that has sort of 3 elements to it that we use to support families in this way. So firstly, we want to start really early. We know that 1 in at least 8 women suffer from postnatal depression and a low mood during their pregnancy and following birth. So we have a postnatal peer support group, which we run in Newbury and Thatcham, that runs weekly. And mums can come along and meet other mums who are experiencing the same sorts of feelings. And it's just such a huge relief to them to find out that they're not alone and that there are other people that feel like they do, and get an opportunity to really talk about those feelings. The mums can come to the group for 12 weeks or 12 sessions, and that can be extended to 18 sessions if it's really needed. And that group has a postnatal depression therapist that comes in every other week. So when things are really difficult, they're able to access one-to-one support as well through our therapist. We also have another section to this project, which is rapid response family support. What we find is that when families have depression, quite often that means that it's really difficult to manage the home and be able to offer their children the support that they need. So our rapid response worker is able to go into the family home within a week of referral and support them on a one-to-one basis and really get them ready for further support. and she can take them to different appointments and do some of that complex work that needs to be done first and foremost. And then we have our volunteer support, which is volunteers can go in, they're trained to support families with ongoing mental health problems, and they are able to get families out into the community and really consolidate the work that we've already done with them to make sure that they are maintaining their mental health and well-being. This project we've been running for the last 3 years, and we're just due to renew the project. And one of the things that we found during the pandemic is obviously it's been very difficult for us to run our groups as normal. So we've been running them over Zoom, and when possible, we've been integrating that with wellbeing walks, and the mums have really, really enjoyed those. So the learning that we've had from running them at this time was that would be a valuable thing to go forward and do. So in our project as it runs forward, we will be adding the addition of wellbeing walks, so a weekly walk, and that's a really good way for parents to step down when they finished in the postnatal peer support group, but they still need some extra support and they still want that light touch. We can provide that with our wellbeing walks. Most of our mums come to us through referral. They come through the health visiting team, and who see them first and foremost, but parents can actually refer themselves as well. So if they're feeling low and they need extra support, they can do that too. On our website, we have a section for referrals, and we have a referral form on there with a handy guide that tells you all about all the projects that we do and how you can go about referring to us. And if you have any difficulties or you would like to refer somebody, but you have a few questions, first of all, about what that will look like or how to talk to a parent about it, then you can get in touch with us either via email or just giving us a call, and we'd be more than happy to help with any queries that you have. So that is our mental health project. Thank you very much for having us here today.
Thank you, Grace, very much for explaining what Home Start are doing for young families. We've had very much a theme of being focused on the young so far from our speakers this morning. I particularly liked your wellbeing walks, actually. It's nice to know it's not all on Zoom, but you're in wellbeing walks, which obviously we can do on a distance basis. So thank you. Slightly different topic now, or very different topic actually, and I'd like to introduce Gary Paulsen, who's chairman of the West Berkshire Suicide Prevention Group, but also the lead on voluntary sector support for charities as well. Gary. Oh, we lost Gary.
Try again.
You're there. Morning, yeah, Gary.
I'm here. Thanks, Chris. Let me share two numbers, 6,000 and 1,850. One number is road deaths in the UK and one is suicide. Most of us would imagine that road deaths would be 6,000. We would be wrong. Each year in the UK, around 6,000 people take their own life. So we're far more likely to have been affected in some way by a suicide rather than someone being killed in a road traffic accident. So someone you know, someone you are related to, a close colleague, perhaps good friend, will have taken their own life. It therefore naturally follows that thousands more people will have had suicidal thoughts, suicide ideation, and perhaps even made a plan to take their own life. In 2017, the Volunteer Centre established the West Berkshire Suicide Prevention Action Group, a multi-agency group comprised of West Berkshire Council, Public Health, GPs, the Coroner's Courts, Racing Welfare, Town Councils, elected members, a consultant psychiatrist, Samaritans, Time to Talk, Suicide Survivors, the Newbury Weekly News, the Charlie Waller Foundation, 8 Bells, Mental Health Mates, and other ad hoc attendance by groups and individuals. Our aim has been to educate, train, inform, publicise and work with groups to share the fundamental point that it is okay to ask someone who may have presented themselves to us in a distressed state, perhaps crying, very irritable, unusual behaviour, tidying up their affairs and so on. If you notice or spot this, the sign says it's safe to ask someone if they've thought about taking their own life. They may answer in two ways. Firstly, God, no, I wouldn't do that. I'm just struggling with a few things at the moment. I'll be fine. In which case you're relieved. In which case, all you need to do is that they're safe in that moment. If they'd said yes, we know that the sign says it is okay and safe to ask if they'd made a plan to take their own life. It's then our job not to try and become an amateur psychiatrist, but rather concentrate on keeping them safe and help or encourage them to make a plan to keep safe. So we could all ask, have you seen your GP? Have you talked to someone? Let's do that. Have you tried talking therapies? Have you called Samaritans? Why don't you and I get together for a good old heart-to-heart, and so on. And the sign says that suicidal thoughts are transient, and if you can keep someone safe for a short time, just a few minutes or a few hours, and provide resources for them to get professional help, then you may well have saved a life. And finally, our group has also done two other important things. We've secured a small amount of cash from West Berkshire Public Health and Wellbeing Board, together with support from Thatcham Town Council and the Greenham Trust, to appoint a suicide prevention outreach worker for 1 day per week. Sue Bennett, some of you may know her, is now making contact with small businesses such as garages, hairdressers, barbers and sports clubs and so on, right across West Berkshire. And she's spreading the word about our training and the resources that are available. So to date, we've trained about 300 people, specifically in West Berkshire, at sessions presented by our group with the kind help of consultant psychiatrist Dr. Jill Cresswell of the BHFT. So do look out for our next training session in September. And lastly, we have launched a simple one-page website. So please take a look at the address on the slide, westberkshiresuicideprevention.org, and on there you'll find immediate sources of help and non-immediate sources of help, Samaritans, of course, and so forth, your local GP. So I would ask you, because actually Mental Health Month is coming up, so if any of you would like to post that website address onto your email signature for a month or so, it's non-corporate, so no one claims to own it. We've just put this together. Do take a look. It's really simple to use, and it could well save a life. Many thanks.
Gary, thank you for that very important presentation there, the working as a suicide prevention action group. And I think, it's very simple advice there on how you might save a life. And of course, I'm sure many people will be interested in your next training course as well. It's great to hear you've already trained 300 people, so far. And I'm sure many other people will step up to get involved in that. So thank you very, very much. If I move on now to another different topic, and 8 bells for mental health, and we've been joined this morning by Catherine Dundas, who's the coordinator there. Good morning, Catherine.
Good morning. Can you hear me?
You're a bit muffled, actually, Catherine.
Can you hear me all right?
Yes, we can now.
Right, okay. Good morning, everybody. And can I have my thanks to Chris and to Laura for facilitating this event this morning. And I have to say, I was one of Gary's 300 actually who attended the suicide prevention course. And it really is one of the best courses I've been on in helping me with supporting people with mental health issues. So I do recommend it. 8 Bells for Mental Health is an independent charity in West Berkshire. We were set up to provide a safe and supportive environment for people with mental health issues. Our age range is, our youngest member is age 19, all our members are 18 plus, and our eldest member is 79. He celebrated his 79th birthday a couple of weeks ago. So hugely diverse group in terms of age range and background. We run a number of drop-in sessions each week to help people with mental health problems, predominantly from Newbury, Thatcham, Hungerford. but we have members as far west as Marlborough and as far east as the fringes of Reading from Tilehurst, and actually one member from London who comes down. We are almost back up to full capacity. We've been able to run throughout the second lockdown 2 days a week, and from next month we're going to be back to our 3 days a week sessions, which are open from 9 till 6 on a Monday, Thursday and Friday. We offer a range of activities: art therapy, meditation classes, engaging with nature, which is an outdoor class, day trips out for people. But more importantly, the demand for our advocacy has mushroomed during the pandemic. We've seen a 44% rise in inquiries for help with advocacy for issues with such as referrals for extra support, housing, debt, employment problems, family issues, relationship issues. So, you know, there has been, particularly I think during the second lockdown, a real demand on our service. And in terms of referrals to 8 Bells, that has increased actually by 35%. So again, we've seen, you know, a big demand for help from 8 Bells for mental health. I've also, I think the biggest increase is from people who've not experienced mental health problems before, who struggled during the first lockdown and then really found it tough going during the second lockdown. And either they were referred to us by other agencies or charities, or referred themselves to us. I'm able to refer people to the community mental health, to talking therapies, to the Berkshire Trauma Service, to Swanswell. We've also seen a rise in people with drug and alcohol issues who are finding it difficult, people with self-harming problems, and also a number of parents who've actually got children. I know there's very much been a young person's theme here, and I've had a lot of inquiries from parents who are seeing their children really finding things tough, struggling, not knowing where to turn to for help. So I've liaised with CAMS, Time to Talk, in, you know, signposting people on. Domestic abuse actually is sadly another problem that's reared its ugly head during lockdown. So we've supported a number of people, and that's been men as well as women actually, and family issues, marriage breakups. So, you know, it's been an incredibly busy time for our charity. And you know, as I say, I drafted some data, and it just shows a significant rise. We, as I say, from next month, we're going to be back open 3 days a week. And if anybody wants further information, everything is on our website. I think that's 5 minutes. I thought I might be the first with the bell, but I'm not.
Indeed. No, you're a long way from the bell, Catherine. Thank you very much. It's very good to hear you'll soon be back up to full capacity, 2 days a week, and soon be 3 days a week as well. So that's fantastic news. And it is interesting, isn't it, that you do deal and help with such a very diverse group of people, you know, both in terms of background, the age spectrum, but also in the challenges that they face as well. And also concerning that, of course, your referrals have gone up by 35%. So we wish you well, and thank you for all that you do for the community. If I move on now to what is our final speaker in this section this morning, that's Councillor Lynn Doherty, who's the leader of West Berkshire Council. Lynn is going to talk to us about the Surviving to Thriving Mental Health Fund that the West Berkshire Council formed with Greenham Trust earlier this year. Lynn, good morning.
Morning, Chris. Good morning, everybody. And it's lovely to see so many people on this call and taking an interest, and actually to listen to everybody's presentations today has been really good, and to see so many familiar faces. My job really is to talk to you about the Surviving to Thriving Fund. This was born out of West Berkshire Council's recovery strategy. We started to consider how West Berkshire would come out of COVID and the impacts of COVID on all of our residents last year. Obviously, we went into a second wave of COVID, and that put paid to some of the work that we were doing. But we very much identified early on that recovering the health of our residents would be a key priority for us. And mental health was identified as one of the areas of greatest concerns. And I think all of the speakers today have alluded to that and told you about the experiences they've had over the last year. So during that year, we were looking at the demand for mental health support likely to be building within our communities, and we wanted to be prepared to respond for that. What we did was we put together an initial £100,000 from West Berkshire Council, which Greenham Trust kindly agreed to match fund, and thanks to Chris and Greenham Trust for that. And Surviving to Thriving was born. Applications are being made via the Good Exchange. I know many of you will be very familiar with that platform. So there's been a lot of really positive work that you can go onto that platform, make your applications on that platform. They're then reviewed by Greenham Trust themselves before sharing with a panel. And a panel that are looking at all of the applications comprises of West Berkshire Council, but also GPs and mental health services and Greenham Trust representatives. Once the funding has been approved, then offers are made, terms and conditions are signed, and payments are instructed. So what we have seen already is that the number of requests has already been greater than the amount that is available, although not all of the applications have been successful. We've seen familiar local providers, and I know some of them are on the call today, such as Dingley's Promise, 8 Bells, Sports in Mind, have been successful, and we've already awarded over £58,000 to date. However, recognising and hearing today that current demand and more demand is starting to really surface as people come out of COVID, and we see the impact that COVID has had over the last year on people's lives, we want to launch a public appeal for public support to raise an additional £100,000. And this appeal is now live on the Good Exchange for all to contribute to today. So really, I'm here today to ask that if you've listened and recognised how important the work of all of the organisations present here today is, alongside other groups within our local communities, to maintain good mental health for our residents of West Berkshire, that you donate to the Surviving to Thriving appeal. This, as I said, can be done on the Good Exchange website, but there are also going to be a number of fundraising events coming up that we would urge you to watch out for, and will be advertised both in the press and on social media. I think there's a great deal of collaborative work going on here within West Berkshire, and we've certainly heard about that today, but we want to keep that going, and we want to make sure that we all can play a role in supporting West Berkshire's recovery. Other than that, I just wanted to thank everybody for all the work that they do here locally. I'm really proud of some of the work, and some of the work I recognise, the Emotional Health Academy, obviously Home Starts work and everything, but it's good to hear about the additional work going on. So thank you to everybody, but please, if we can all take our part and spread the word, so you will all know of different people around West Berkshire who may be able to contribute to the appeal. If you can all spread that word, it would be very much appreciated.
Thank you, Lynn. And it's good on behalf of Greenham Trust to be working with West Berkshire Council as well on the Surviving to Thriving Fund. And we did receive a boost yesterday, which I don't think has permeated out yet to the group. We got a separate donation of £10,000 from the Miss Lawrence Trust as well. So that's quite a boost for Surviving to Thriving as well. So I think that's very significant. Thank you, Lynn. Thank you, everyone, this morning. And we've kept to time as well, which is good. And also my colleagues have been obviously going through the questions, and the panel members have been answering questions as we've been going along. Can I just remind you of how you might ask a question? If you click on the Q&A button, which is in the centre of your screen at the bottom, and then on the pop-up window, you can type in your question, click send, and then you'll be notified when you've asked that question and that the panellists will see it. So I will be doing this in real time, so bear with me, and we'll look at the questions that appear on our screen. But first, if I had 3 questions that we received in the previous week, actually, that I thought we'd address to the panel. So I'll just read those out because they're not available on the screen. So the first question we had this week was from Keith Hoddinott, who's chairman of the Newbury Junior Netball and Thatcham Flood Forum. He said, in relation to mental health and well-being in schools, does the forum agree that sport and nutrition has an essential role to play in helping youngsters through the current difficult times and a template for future development in all schools as a core subject and after-school facilities? Now, I believe Sarah Emery, you were happy to touch on this one for me, please.
Yeah, and I think a similar question came in through the chat. In terms of our programme that we're delivering schools, absolutely, wholeheartedly behind the role that sport, physical activity and nutrition can play. And for us, it's very much about empowering young people with that knowledge to understand the role that those things can play in supporting their mental well-being. So yes, wholeheartedly, and I know a couple of other panel members have commented on that as well. I think there is a role for schools to play, but we also have to recognise that the school, a lot stops at their front door. So it's also about, as a community, how do we come around young people and make sure they have the right access to the right information, that the netball club can play in terms of supporting young people's mental health, as well as, faith groups and uniform groups and youth groups, and how they can continue to support young people. So I think we all have a role to play, but absolutely advocating that for young people.
Thank you, Sarah, for those comments. The next question I have, which came in the course of the last few days, was from Helen Knoll, who is Head of Volunteer Services at Lambourne CIC. Helen said, outreach programmes to small rural communities that have restricted transport routes are desperately needed by all ages of the community. Is there a way to try and meet this need? Gary, I thought that might be one for you, actually.
Thank you very much. Yeah. Okay.
So
voluntary sector transport is quite active normally, but of course it's been restricted during the pandemic. That is now opening up. I do know that the handy bus, which operates in Hungerford and is shared with Kintbury, has in the past done routes from Lambourne, and it may still do that. I don't know, but if it's certainly worth exploring with Chain, who operate the handy bus in Hungerford, to see if they do, and if not, we'd be very happy at the Volunteer Centre in Newbury, because we also operate Newbury and Thatcham handy bus, and it may well be that we could train one of your volunteers to use our handy bus, and you could borrow it from time to time. So that's something that we could certainly talk about in a bit more detail, and just explore what it is you're looking for, if there are regular evenings and so on. So it's certainly relatively easy to explore.
Thank you, Gary. That's very useful indeed.
I'll put my email address in the chat box.
Yeah, if you can do that, yeah, and it will be available after the presentation as well. Thank you. The final question we had in the last few days, quite a long one actually, so bear with me on this one. David Fisher, David is from Younger People with Dementia. David said that given that people with young onset dementia, who are typically in their 40s or through to early 60s, have totally different needs to older people, they might still be working, supporting a family and education, and have mortgages and other financial responsibilities. How do you see their future under current legislation? And how can a charity such as ours, Young People with Dementia, Younger People with Dementia, best help? Throughout lockdown, David says that they've kept their employees on full-time, full pay, supporting their service users through regular telephone contact, activity packs and internet workshops. And he was asking for any more suggestions on what they might do to help. Laura, perhaps if I may ask you on the legislation side of things, I don't know if you have any comments on that.
I have to confess, I have never been asked a question about early onset dementia. I'm going to have to be completely honest and say it's outside the realms of my knowledge. I was sort of thinking it through as I was listening to the question. I think that I don't know if there's any sort of health professional on this who would know more about it. I'd be happy to take this up actually offline. again.
Okay, I think that's good enough. Thank you, Laura.
I take it up to the Department of Health. Yeah.
Yeah, David, if you are online this morning, I can't see that you are, but if you are, then please, Laura is happy to do that. Matt Pearce, any comments from you?
Yeah, happy to. So firstly, thanks for your question, David, and the great work the organisation does. I agree that younger people with dementia often face a number of different challenges compared to older adults and go under the radar. I guess in terms of how your organisation could support people living with young onset dementia, I think there's a number of things you could possibly do. I think firstly, perhaps raise the profile of the young onset dementia, particularly with local employers, businesses, provide local advocacy for young onset dementia, and also be a point of contact for employers and support and staff to support them. So if a colleague is diagnosed with dementia, kind of what are the reasonable adjustments they might need. You could also network with local dementia organisations. So we have quite a successful dementia-friendly West Berkshire here in the district. And we also have a Dementia Friends programme, which aims to raise awareness of dementia. And I guess, other things you could look at is how we could possibly, as restrictions are lifted, what kind of things could we do around workshops, peer support groups. But certainly, I think, linking in with the Dementia Friends programme in West Berkshire would be really, really helpful starters.
Thank you, Matt, and thank you, Laura. So hopefully that's a good answer to the question, some help we can give after this forum this morning. So one thing I would say, we've had 28 questions throughout the presentation this morning, all of which have been answered by various panel members and colleagues. So they will be available and be supplied and circulated to everybody who's been involved in the forum this morning as well. There's way too many for me to run through now. I have still got one live one on the screen here, and this is from Nigel Foote. Nigel, I don't know what organisation you represent, but Nigel says, can the panel discuss how hard to reach groups, such as children out of school or mothers at home in difficult domestic situations, ethnic groups are reached? So I think a number of the panel members are involved here. So I think, mothers at home in difficult domestic situations, perhaps Grace Green, you might have a comment on that and how you reach your target audience.
Yeah, absolutely. I mean, I think it comes down to the fact that it's everybody's responsibility to make sure that we're identifying these families. Who is seeing that family within the community? Is there another organisation that's seeing them that could see that they're in need of some help and refer to us, so that we can support them? It's difficult if we don't know they're out there. It's always been a real challenge. I think once we make that connection, we can then do the work. But until we know that they're there, that's a real struggle. So it's just making sure that that people are aware of what we do, so that when they do come into contact with those families, they can refer to us.
Thank you, Grace. I think I just go for the very fact that it's incumbent on all of us, panel members and people who are listening this morning, that if you are aware of people who do need help, it's back to it's okay to not be okay question. It's important that all of us, get involved in that and be kind, as I think Andrew said from Health Watch earlier on this morning. There are no more open questions. As I said, all the questions that have been asked during the course of the forum and been answered will be circulated after the session. We have remarkably kept time this morning, so thank you to all the panelists for enabling us to do that. So I'd really now like to come on to Laura Farris MP to give her closing remarks. Laura, please.
Thank you very much, Chris, and thank you so much to all our speakers, because first of all, I learned a lot by hearing how the local government and the voluntary aspects of mental health services work together and interact. And I was just incredibly struck by the level of commitment from everybody who spoke today, and the way that they work to cover sort of such a range of different types of demand. And I think we all, I was just really struck by the kind of holistic service that is available. And I think we, have a duty to do all we can to make sure that people who have a need are able to access the support that's there. I wanted just to touch on a few things that I think came up this morning. First of all, I think, and I'm going back really to Matt's opening presentation, because he was talking about some of the trigger causes that are likely to exacerbate. And I think we can all recognise that the multiple consequences of a year like no other have created a lot of triggers, and there is really an immediate need on mental health. And one of the things that struck me, and it always does whenever I really listen to experts talking, is how important early intervention is. And it can sound sort of a bit vague, but when you really think about it, I think the Charlie Waller Trust talked about it, Time to Talk talked about it, and I saw in the chat the Mary Hare School, sorry, I just looking through quickly, were talking specifically about how important Time to Talk's involvement had been to their children. So it just reinforces to me how much I want to help the voluntary organisations today to get into schools where they can, and that schools can have a good dialogue, and that young people can be linked up with that. It was also really moving to hear about suicide from Gary Paulsen, that shocking statistic at the beginning, and also actually the Charlie Waller Trust, which has become so well known in West Berkshire, but it was really well introduced, and I remember the day that Charlie died, and it is an absolute credit to his family, the way they have taken a huge personal tragedy and created a really, really important charity that actually has scope that goes well beyond Newbury and West Berkshire, and lots of people have heard of it, and it's good to be reminded of that. And then again, Catherine Dundas from 8 Bells reminding us about things like just really the complexity of what she's seeing, addiction, and it reminded me it's important not to silo things, because when things go wrong for people, particularly around debt and loss of jobs, you know, drinking or using is really often really quick to follow, because it's escapism. Or it's not escapism that's actually going to help anyone's mental health, but it's easy escape routes. And I thought she gave a very important talk about spotting the signs and what she's seeing. So I just wanted to wrap up again to thank everybody who spoke. I really found it a powerful and important presentation, and everybody who attended. And I just wanted to say finally, if anyone is inclined to support the ongoing fundraising work of the voluntary sector, because there's so many people who are giving up, you know, their time and who've really dedicated their lives to this. And obviously West Berkshire Council provides an amazing bedrock, but I really think we can augment that service through some of the brilliant charities who've appeared today. And Chris, could I just ask you to either put in the chat or I don't know if a slide exists, just to remind anybody who's watching how they could donate if they wanted to at the end of this. I think it was on one of the previous slides, a couple back, but
we'll certainly do that, Laura. Yes, it will be in the resources slides. Thank you very much for your closing remarks. It has been, I think, a very interesting and informative session this morning. So thank you to you for helping us put this together, but also thank you to all the panelists for giving your time to talk this morning, which has been very useful indeed. And also thank you to you, the audience. You know, a significant group of people have been involved this morning online, and it just shows the power of, you know, what you can do in these challenging times that we face. But this is such an important topic. There are lots of resources that will be available post the session. So there will be a recording of the whole thing this morning. So basically, if you want to listen to it again or watch it again, or if you want to pass it on to colleagues, you'll be able to do that. And certainly there'll be all the slides will be available too. But yes, as Laura said, if you can support the Surviving to Thriving fund, then we will make sure that details of that and how you do that via the Good Exchange are supplied as well. So I think that's it for this morning. We kept remarkably to time. Thank you again, everybody, for getting involved this morning, both the panelists, to Laura, and you, the audience. And we look forward to seeing you again soon. And no doubt, I think we might well have other forums on this very same topic as we go through the next few months, as we hopefully come through the recovery period out of COVID. Thank you again, everyone.